Good morning, everyone, and welcome to our virtual program, How to Go Out and Feel Safe Against COVID-19. Just a few items before we get started. Please make sure that your device is muted and that your audio is off. If you have any questions during the program, please make sure that you use our chat feature and someone from the team will get back to you. We are hoping that we have no technical issues, but as you know, in our virtual world, sometimes things do happen, so please bear with us. As you heard, we will be recording this webinar and we will be sending it out after the program if you're interested in listening again or sharing it with others. It'll also be available on our website within the next 2 weeks. We are very grateful this morning to have Doreen McSharry, Director of Safety Infection Prevention at Hackensack Meridian Health Palisades Medical Center, as our speaker. Doreen has over 25 years of experience in the fields of safety and infection prevention and is certified in both. She holds a Bachelor of Science degree in dental hygiene from Fairleigh Dickinson University, College of Dental Medicine, and Master of Arts degree in Environmental Health and Epidemiology from Montclair State University. And with that, I would like to turn the presentation over to Doreen.
Thank you, Robin, for that wonderful introduction. I also would like to add that I've lived my whole life in New Jersey, so I'm trying to really provide this presentation today from a Jersey perspective that all of you can hopefully understand and enjoy. So the goal of today's presentation is really to provide some information about COVID in an informative and relatable fashion. I've included some photographs to this effect that you might have seen along the road. I've included some photographs with respect to how to wear your mask and what to wear. Again, we've been through a tremendous amount of time and difficulty over the last several months. And I just want to encourage everyone that I'm sorry, one second. We are going to get through this together. So everyone just hang in there. We will get through this together. All right, thank you. So again, our general objective today is I'm going to define for you coronaviruses and explain to you how they're transmitted. Much of this we already know, but just to reinforce. I'm going to provide an overview of preventive measures that you can take to protect yourselves and others from COVID-19. And again, in today's COVID-19 world, we'd like to talk about how we're going to shop, how we can get together with friends safely, how we can enjoy our meals, and how we can prevent the spread of infection among kids especially, and how we can get through our everyday life. All right, so what is a coronavirus? Okay, so coronaviruses get their name from their appearance. So there's a scientist somewhere that thought that a coronavirus actually looked like a crown. So the little spokes that come off that coronavirus looks like a crown to them. So coronaviruses, they're a family of viruses that can often cause the common cold. But the difference is a COVID-19 is not the virus that causes the common cold. So how is the COVID-19 different? So the COVID-19 is what we call a novel coronavirus. It originated in animals and it crossed over into humans. So once it entered that human host, as we call them, it was able to be transferred from person to person. So we as humans lack immunity to the COVID-19 because we've never had exposure to it before. But genetically, it's very similar to SARS or MERS that we heard about a couple of years ago. So one of the reasons why COVID-19 is such a concern is that people can be infectious prior to developing symptoms. And some people also are totally asymptomatic, which means they never show any kind of symptoms, but they are infectious. So let's go over some basic symptoms of COVID-19. So we've all heard about the cough. We've heard about shortness of breath, fever, chills, muscle aches, sore throat, and an unusual symptom of loss of sense of smell or taste. all of these other symptoms we've heard of before with the common flu or some of the colds. So generally, after an exposure to COVID-19, we see about 5 days after exposure to 14 days, that individual can develop the COVID-19. So again, let's talk about those key symptoms: fever and tiredness, a continuous cough, and then that odd loss of taste or smell. And then we hear about these aggressive breathing difficulties that we've seen in the news. So I'd like you all to focus on this photograph. Now, Mr. Unmasked Man here, we don't know exactly what he's doing. Is he coughing? Is he talking? Is he singing? Is he speaking? Is he yelling? But all we know are his respiratory droplets are traveling 3 to 6 feet. And again, if we have someone that maybe has a stronger respiratory system, maybe a runner, perhaps those droplets can travel even further. So again, just imagine that unmasked man and how far his respiratory droplets are traveling. So let's talk about how they are spread on contact. So let's talk about Mr. Unmasked Man that has now gotten those droplets on his hands, and now he's touched all kinds of common surfaces, okay? So then we go and we touch those common surfaces, and we decide to touch our face and our eyes and our nose and our mouth with these unclean hands. Now, the interior of the nose is particularly sensitive to picking up viruses. So that's why we must always cover our nose with a mask and be very careful not to touch our faces. So again, common items we want to be concerned about are doorknobs, buffet utensils, for instance. Again, you will notice that buffets right now are a thing of the past because we're not going to be wanting to be sharing all these buffet utensils. So there's a question that's been circulating right now about COVID-19 and will the weather, when it gets warmer, stop COVID-19? And unfortunately, the answer to that is no. So if we notice right now, Arizona is a hot spot, literally, for COVID-19. Yesterday, Arizona was 104 degrees, and they are alive with COVID-19 right now, unfortunately. So unfortunately, warm weather will not stop the COVID-19. All right, so I'm going to tell you a story. It's actually a true story without specific details of a memorable Memorial Day weekend down the shore. So, and it was memorable, unfortunately, for all the wrong reasons. So I'm going to nickname this little guy in the corner John because I have a brother named John. So number one, John. So John went down the shore over Memorial Day weekend, and a bunch of his friends and he had a shore house. So John, unbeknownst to everyone, just so happened to have come in contact with COVID-19 while he was there. So John, after Memorial Day weekend, went back to his home in Pennsylvania, and he infected 11 of his closest friends in Pennsylvania, and they went on to infect at least 33 others. So this is why it's so important that we socially distance. We are not out of the woods yet, folks. All right, so far, as of the 29th of June, there were 2,541,479 cases of COVID in the United States. And that's a very, very high number. We're basically approximately 330 million people in the United States, but that's a very high number of COVID. All right, so we talked about this a few minutes ago. We want to wash our hands constantly, okay? So whenever you get the opportunity, you wash your hands, you sanitize your hands. Always imagine everything that you've come in contact with was previously touched by someone else. So this goes for the common cold, the flu, whatever. But COVID especially, it's very important. We want to cover our cough if we're coughing, okay? So in a general situation, when we don't have COVID, we want to cough into our elbow. We want to cover with a tissue, with a paper towel. We want to do something to contain those droplets so they're not traveling like Mr. Unmasked Man a few minutes ago in that picture, okay? And we want to avoid touching our face, because if we rub our eyes and we rub our nose and we inoculate our face with that organism or that infection, it's going to easily get into our bodies. All right, so I have to give credit to Governor Cuomo and Governor Murphy for all the great signage on the highways, and you're going to see a few photos of those along the way. So again, they continuously remind us to wash or sanitize our hands frequently. So when do we wash, or how do we sanitize, and so on? So again, we're going to wash our hands for 20 seconds with water and soap, drying on a paper towel. We prefer to use warm water, but it doesn't have to be. But when we use warm water, it tends to prolong the time that we will be washing our hands, especially in the winter, because it's not such a shock to our hands. Sanitizing has become extraordinarily convenient. All right, so when it comes to sanitizing, you want to cover all of the surfaces of your hands. Focus on your fingernails, okay? Your nail beds, your thumbs, okay? And then you're going to allow it to air dry. It's extremely convenient, extremely portable. Despite the fact we had a shortage of sanitizer for a long time, it's back up and available for everyone. So please sanitize your hands. So the difference really between sanitizing and washing is if your hands are visibly soiled, you have dirt, you have food, you have blood or body fluid on your hands, you want to use soap and water because the sanitizer won't penetrate it. A question also has been coming up a lot about gloves. Do we wear gloves to prevent COVID-19 or do we not? Again, gloves are really intended for healthcare workers immersed in the COVID-19 blood and body fluid, touching, laying hands on patients. Okay, if we are driving our car, we should not have gloves on our hands. If we are jogging down the street, like the gentleman I saw this morning, we should not be wearing gloves on our hands. Those are situations in which you really want to sanitize. With gloves, when you peel those gloves off, you can easily contaminate your hands, but they also have kind of a sticky surface to them that allows you to transfer bacteria and viruses from surface to surface to surface. So we actually put others more at risk and ourselves at risk by wearing those gloves. All right, so this came up in the news last week. There was an accusation on social media that someone had set their car on fire by having a hand sanitizer left in their car. So this is a product I like to use all the time. I keep it in my car all the time. I will tell you that hand sanitizers are alcohol-based, and alcohol can ignite if it comes in contact with a flame, okay? But if it comes in contact with a hot car, it's probably not going to ignite, but it will distort the plastic. It might spill. And I will tell you, if you have metal surfaces in your car, it will etch and damage those surfaces. So just be careful where you place it in the car, but certainly keep them accessible for everyone. All right, so these are just some examples of sanitizer that we talked about. Again, I have a Clorox product, a Purell, something kind of no-name brand. And then I raided my daughter's desk. She's not home right now. So I raided her desk and I found a bunch of Bed Bath & Beyond products that are quite fragrant, I might add. But whatever the case, we need to make it accessible. We need to make it fun. We need to make it available so that children and people of all ages really can clean their hands. So we know we've seen them over the years attached to backpacks and lunch boxes and so on, but kids really need to get into that groove of continuing to clean their hands. And again, by providing them products like this that have some fragrance to them, that are colorful and fun, we certainly can enhance their compliance. All right, we're going to cover our mouth and nose. Again, thanks Governor Cuomo and Governor Murphy. And I just want to tell you all, my mask is right here. I'm alone in the room. I'm socially distant, but I'm just trying to give you respect, so I'm not wearing a mask in the room. But if we're going out, we need to mask up, okay? So, and it really doesn't matter what you use to cover your mouth, okay, and your nose. You can wear any kind of face covering, okay? So when you wear this mask on your face and it's over your, please don't wear it like this, okay, because the infections can be coming out of your nose and your nose can be uptaking those infections really well. So anytime we are out of our own home, we should be out wearing a mask, okay, even if we're outside. So again, I watched some people running this morning. So someone was running this way and someone's child on their bicycle was going in the opposite direction within that 3 to 6 feet. So that is an opportunity to expose someone to COVID. Adults and children over age 2 should wear masks. Kids, we know it's going to be a little difficult for them. So let's do our best, again, to help them. Again, the requirement does not require what type of mask you're going to wear. The idea, again, is to control those droplets from traveling by keeping them on your face. Again, if you wear that for a duration, the inside of that will get wet. Once it's wet, the mask, the paper mask or disposable mask should be thrown out. The washable one should be washed. But again, it really gives the wearer the freedom to be themselves and to express their individuality. So what I really want to recommend for everyone, especially if you have children, because the kids are tired, they've been cooped up for so many months, they want to get out with their friends, they want to have fun on their bikes, but we really need to encourage them to wear their masks. So again, I saw over the weekend someone wearing SpongeBob. I saw another boy wearing Spider-Man, someone else wearing Batman. So again, make it fun for them. Make it so that they are willing to wear these masks to protect themselves and others. So I'm just going to show you a couple photographs of how people, can protect themselves. Okay, so just before I do that, let me just mention, should I wear a mask when driving or riding in my car? All right, so if you're riding alone, you don't have to wear a mask. And if somebody from your own household is in your house, is in your car, you don't need to wear a mask. But if you are riding with someone, for instance, if you're an Uber driver and you are transporting someone that's not your family member, both of you should be masked. If you are riding with a coworker, let's suppose we're all back to work again and COVID is still around, that coworker and you must both be masked. So we need to control the droplets, particularly in that confined environment. All right, so this is just an example. These are my team members. So at work, in every Hackensack Meridian facility, you will see all team members masked at all times. Okay, the only time we'll take that mask off is when we're eating something. But again, we will be socially distant at least 6 feet when we're eating. But otherwise, we will be wearing one of these disposable masks. And I'm going to show you some other examples with a little bit of humor, but also to demonstrate how we can wear a mask. All right, well, this bandit here is my brother-in-law. And Albert, he usually wears his bandana on his head. But now, when he's protecting himself from COVID, he lives in Philadelphia, he walks down the street like this. Okay, so he puts his bandana over his face and on his head. The other is my daughter, and Margot is wearing what happens to be Vera Bradley, but not to promote any brands. But again, this is an example of how we can make it possible and comfortable and fashionable for a teenager to wear a mask. They're wearing something that is fun and fashionable. All right, so we're going to move on to the next slide. All right, and these are friends of mine, a couple of pastors that happen to be lovers of Harley Davidson. So when they ride and when they're going about their daily business, they're actually wearing, whether it be a regular mask, whether regular cloth mask, or a bandana type mask to control the droplets. All right, so let's talk about disinfecting common surfaces. So again, thanks to our governors, we're going to disinfect to protect. And again, we continue to wash our hands. So we want to disinfect frequently touched surfaces. Okay, so what's most important in our work and at our home are shared items. So we want to talk about doorknobs, handles, countertops, toilet sinks, a hardback chair, for instance, light switches, our tablets, our phones, our keyboards, remote controls. But just be very careful that the product you're using is compatible with the surface. All right, there are many bleach products, for instance, that are very damaging to surfaces. And in addition to being damaging, they leave a residue behind. So just be sure what you're using is compatible. All right, so I'm just going to go over with you what kind of products you should use. So first of all, your surface needs to be clean first. Okay, so the first thing you want to do is be sure there's no visible soiling on your surface. Okay, the next step is you're going to rub the surface. And as my grandfather used to say, you use elbow grease. Okay, you rub it with some effort. And then after that, you're going to wipe that surface with the disinfectant and allow that disinfectant to air dry. And that air drying process is actually what kills the bacteria and what kills the viruses. So there are many products on the market. Pretty much if they're labeled for disinfecting, they would be compatible against killing viruses in your home. But some examples would be a hydrogen peroxide-based product, a Clorox disinfectant wipe, some disinfectant cleaners, multi-surface cleaners. And CDC also recommends you can make your own, but again, this can be a little bit messy, but it's generally 1/3 cup of bleach to a gallon of water. And again, please be sure that it's compatible. Let's not damage our equipment, and just be safe. The next of what we don't want to use, I hear there's something going through social media of people trying to clean their surfaces with vodka. Please, make your screwdriver, on a Friday night, don't use it to clean your house. Do not use vinegar. Vinegar really has not been proven to kill viruses such as COVID. Be cautious with natural cleaners. Again, these have not necessarily been proven. And something else I need to caution you about are UV lights that are being sold on the market. In healthcare, we use FDA-approved UV lights to kill organisms and infections that are left behind in patient rooms. But what's being sold on the market right now is very, very dangerous. I have a friend whose elderly brother bought a UV lamp and he gave himself a horrific sunburn. Okay, because he really thought he was going to be able to sanitize his common items. And he probably did, but he also hurt himself. So please be very, very cautious. Do not be bringing these products into your home. It's much better, again, to clean, use your elbow grease, and use a disinfecting product. Another product that has not been proven to be effective is saline solution. So please keep that all in mind. All right, so there are a lot of discussions going on about products that we are bringing into our house, whether it be from the supermarket or shipping containers or anything of that nature. So there's a lot of discussion about how long does COVID live on a surface. And again, the research is a little bit unsure right now, but we look at viruses and what they're saying currently. So they talk about certain plastics. So plastics such as milk containers and things of that nature, viruses can live on them for 2 to 3 days, for example. Cardboard, they say 24 hours. Paper, depending on the type of paper, can be minutes to 5 days. Currency, they say, could be up to 2 days. Wood, 1 to 4. Cloth, up to 24 hours, so like your clothing, for instance. Glass, up to 5 days, so we can say like a jelly jar or window glass. Stainless steel, such as your appliances. Aluminum cans, 2 to 8 hours. Copper, such as pennies, they say about 4 hours. So, and this always assumes that these items haven't been disturbed by anything. So they've been kind of locked away with viruses on them without anyone else touching them or coming in contact with sunlight or anything that would have disrupted them. So my recommendation really to everyone, again, if you feel you need to wipe things down, make sure it's compatible, but please be sure, of course, with a plastic such as a milk container, you really want to be careful you're not putting chemicals in contact with your milk containers. So the same goes for cardboard. If you receive something from Amazon, do you want to wipe it down? Do you not want to wipe it down? My recommendation to everyone really is just to continually wash your hands. All right, I'll give you an example with respect to cardboard. So my daughter brought someone a gift 2 weeks ago, and the parent wouldn't let it in the house for 48 hours because they were fearful, because I work in a hospital, of COVID carrying on to this gift and being transferred into the house. My recommendation, again, is handle these items and then wash your hands. COVID is not going to leap off of these items onto you. It's not going to be aerosolized off of these items. You want to continually clean your hands. All right, so hopefully that answers that question. All right, we're going to continue to stay 6 feet apart. Okay, so as Governor Murphy says on the roads, so that's a little humor there, no tailgating, folks. But again, in the parks, at the beaches, we want to be careful that we're 6 feet apart and we continue to mask. And again, I'm sorry, even if we are outside, we are supposed to be masking ourselves when we're within 3 to 6 feet of people. All right, so I just want to tell you, we are not out of the woods. Okay, we want to keep our home as our sanctuary, including our yards. All right, Again, forgive me for referencing personal issues, but my daughter, for instance, keeps getting invited to pool parties and backyard parties and barbecues and so on. We are not out of the woods, okay? Keep your home as your sanctuary. Please do not be gathering people to your house that do not live with you. There are many people who are asymptomatic carriers of COVID, and we don't really want to provide that as the petri dish and the opportunity for people to contract COVID in common environments like that. The elderly people are still extraordinarily vulnerable to this, the very young and the very old. My mother's in an assisted living. I haven't seen her in 3 months. I haven't laid my hands on my mother in 3 months. We need to protect the elderly, okay? In public places, again, in the stores, fortunately, our shopping carts, for instance, are close to 4 feet long. So that will help us with some social distancing, but try to follow the cues. So follow the instructions of the arrows on the floor and the lines and the circles and however it's been set up. In cafeterias and conference rooms, again, please be sure you're 6 feet apart, particularly when your mask is off and you're eating. The churches and the synagogues have reopened, and some of them have some awesome processes in place. People are seated 6 feet apart. There's sanitizer close by. They're requiring that we wear our masks. These things are very, very important. And, a rabbi recently told me that he got into a little argument with his congregation because they wanted to sing one of these wonderful hymns in which they're really projecting their voice. And unfortunately, singing is a great mode of transmission for COVID, unfortunately. So we need to continue to mask ourselves. So restrooms, I'm going to leave it right there. But from what I understand, there's going to be some social distancing in the men's room. So just keep in mind, you might anticipate that. During meal times, again, observe the cues. Please don't rearrange your chairs. So if you're in a cafeteria at your job, and there are 2 chairs at a 6-foot table, please don't pull chairs over so that you can hang out with your friends, because we're trying to protect you from yourself, okay, by separating each other. Again, we miss each other horribly, but we really need to protect each other. So, and again, so I put a picture up here of Mama Bigfoot, okay? So Mama Bigfoot doesn't want anybody within 6 feet of her baby. So moms and dads out there, please remind yourselves of that, okay? Especially if you have newborns, it's very difficult. We want grandma to come over and see the newborn. We need to be very careful, because we do not want to put anyone at risk for exposure to infection. So if you're out and about with your stroller, again, keep a distance. I know it's really hot outside, but perhaps we need to look into putting some kind of covers over your strollers, because we cannot mask babies or anyone under two years of age. So just try to be a little ingenious that way and see how you can put barriers between yourself and your stroller and other people. Okay, so these are some floor markers that you will see at Hackensack Meridian Health. So when you enter into our lobby, we will take your temperature. You will stand on a floor marker that will designate you to be 6 feet from someone else. In some of our cafeterias, you will see such things as these arrows that show what direction you should be walking in. All right, so let's talk quickly about takeout. Okay, so can COVID get spread through food, takeout, packaged food? What's the proper way to clean produce? So with produce, pretty much you want to take that produce home, run it under running water, removing the soil, and rub the surface whenever possible. Do not use chemicals on your produce. Again, COVID is not a foodborne illness. All right, you want to keep washing your hands. You want to wear a mask when you're out and about. Clean your hands after handling takeout containers, and follow whatever precautions are being designated for you. So I'm just going to give you some other examples. All right, what to expect from dining out. All right, so you're going to see signage at the entrances. You might be limited to 8 people per table, 6 feet apart. Waiting patrons, either wait in your car if you have a reservation, stay 6 feet apart. You will see hand sanitizer everywhere. You will see disinfectant. You will see team members in restaurants disinfecting tables, such as credit card machines, counters, and so on. And you might also see some markers that say sanitized. Okay, so that might be placed on your table that says sanitized to make you feel more comfortable. So again, you'll see some visible hand sanitizer. You will also see menu list menus, okay? So you won't see paper menus around. You might be in a position that you'll be able to scan a code and that menu will come up on your phone, enabling you to order, based on that menu. All right, so let's talk about some extra considerations. If you sit down to eat your meal and you need to get up to go to the men's or the ladies' room, you must put on your mask, okay? We're encouraging reservations for social distancing. You're going to have fewer seats at the tables and don't rearrange those chairs. Again, we talked about the digital menus. Most likely, we're going to be using our phones as buzzers and pagers. They will no longer be distributing those buzzers and pagers. Also, you won't be seeing too many buffets around anymore. If they might have been abolished, okay? And you probably heard in the news that unfortunately indoor dining has been postponed. So if you're walking around in a restaurant with no mask, you can be denied service according to the law. So please keep that in mind. All right, just again, this is an example. You might not see bottled ketchup on the floor, on the table anymore. You might be seeing some single packs. All right, so this is an example of tables. So I'm not really sure what they're saying specifically here. To me, this reads that you shouldn't be sitting where those X's are, but there are some chairs there. So just follow the cues when you go to restaurants and when you dine out. All right, this is an example. Friends of mine own this restaurant in Paramus. It's called Biagio's, but whatever the case, they've done an awesome job. So I just wanted to showcase this particular restaurant. So you could see their tables are outdoors. It's beautiful weather. And they have, right now they have 6 or 8 chairs at each table, but mostly 6. And again, they are 6 feet apart. So this really exemplifies what we should be doing when we're dining out. So golfing, okay? Any of you that are, what you want to know before you go, again, make your reservations online or over the telephone and pay for them then. Your tee times might be 16 minutes apart. Okay, that's what we're expecting. 1 person per golf cart, and you will see them continually cleaning the golf carts. And for those of you like me that constantly hit their ball into the sand trap, your bunker rakes will be gone. Water coolers likely will be gone. Ball washers, anything that we touch in common. And golfers are expected to be masked and 6 feet apart. All right, so we all know that we're hoping for some marvelous indoor entertainment news. Okay, so we understand arcades and bowling alleys will be open, museums, aquariums, batting cages, amusement rides, water parks, but we know concerts, unfortunately, will not be starting for a while. But please observe the mandatory masking, the hand sanitizing, disinfecting of surfaces, and social distancing. Please discourage your kids from huddling around these pinball machines and other games. Yeah, that's what kids like to do. But unfortunately, we really need to be careful to socially distance those kids, particularly in those environments when we do not have air circulating, and we know that they're going to want to pull those masks out. But you will see some creative ways in which they'll be blocking their pinball machines and other arcade games, and in this case, Iron Man. All right, so here's the lowdown down the shore. All right, so 6 feet apart, beaches, blankets, and so on. If you're walking, running, exercising, we are expected to be 6 feet apart. They're recommending surfing and swimming 6 feet apart. And with the jersey undertow, I'm not really sure how we're going to pull that off, okay? But masks are encouraged. You will see the lifeguards will be socially distanced. You will see 1 lifeguard on the chair while the others are walking or waiting. Okay, wading, sorry. Please discourage shared beach toys. Again, these kids have not socialized in a long time, but we know that COVID can be shared on common items and spread that way. All right, so let's talk about the pools. Okay, so the public pool party precautions. Pools open June 22nd. In my town, the pool isn't opening this summer. just because of these precautions and the risks. So if you don't feel well, please do not go to the pool. Okay, you can anticipate they'll likely be taking your temperature when you go to the pool. Stay 6 feet away from people when you're in the pool and when you're sitting on the sidelines. Okay, when you're tanning yourself, except your face because you're masked. Be very careful with pool noodles, boogie boards, anything we share in common. Do not assume that the pool water is going to clean those items. Okay, so we should not be sharing these items. If you're not in the water, put on your face covering. Clean your hands frequently. And again, cover your coughs and sneezes. You cough into your elbow, of that nature, okay? All right, so I just want to say thank you to everyone for doing your part to keep New Jersey safe. I'm really wishing you a safe summer, and I'd like to say Jersey style, and acknowledging Governor Phil Murphy here. And in the words of Jersey, don't be a knucklehead, all right? COVID-19 is still a risk, so please everyone be safe, wear your mask, socially distance, wipe everything down, and keep washing your hands. So just to cover a few housekeeping items, I just want to inform you what we're doing at Hackensack Meridian Health to protect your safety. So in case you're hesitant still to seek personal care, we just want to let you know how we're prepared. So we're here to protect you and we're following these actions. So at all of our entrances, you will see designated entrances at our hospitals for certain procedures and services. We're monitoring everyone's temperature. So everyone that enters the facility will get their temperature taken. So whether you're a visitor, a patient, a team member, or a physician, you'll get your temperature taken. So we are rigorously cleaning all surfaces in the manner in which I described earlier, using all hospital-approved products. We're also using a hospital-approved, FDA-approved UV light for cleaning our areas, and we're also cleaning and fogging any areas that might have been potentially at risk. And we're using nationally recognized third-party organization to oversee our efforts to be sure that we're abiding by all federal and state standards, and we're testing our air, water, and surfaces to make sure everything's safe. So we're testing all of our patients that are entering our hospitals. Again, all of our team members are wearing masks. Okay, so as you enter, you will be issued a mask to a patient, a visitor, team member, physician. It is a requirement at Hackensack Meridian Health. And our team members and physicians all have the appropriate personal protective equipment to do their job safely, to protect themselves and our patients. And we practice social distancing. So you will see in our facilities, wherever possible, we have social distancing of 6 feet apart everywhere you go. So again, I just want to say thank you to all of you for participating in this webinar. It's really an honor to have this opportunity to speak with all of you. And I'd like to thank my team members at Hackensack Meridian Health for inviting me to participate and to share this information. Thank you, everyone.
Thank you, Doreen. That was an awesome presentation. I'm sure we've all learned a lot that we did not know. We have had several questions submitted, as well as questions that have been submitted through the chat. So we're going to take some time right now to go through them. So the first question we have is, how does COVID present in patients with Parkinson's, given that most of them have lost the sense of smell? I apologize, my screen is jumping back and forth. Smell and taste that often occur in Parkinson's. So I'm not sure if that's something that you can answer for us.
Yeah, I mean, that's more of a medical question, but just to reference that not everyone gets every symptom. All right, so there are plenty of individuals that have had COVID that are totally asymptomatic. So a presentation in a Parkinson's patient, again, really will not differentiate that much from the other symptoms that have emerged, because again, you could have cough, you could have fever, you can have shortness of breath, which are more significant and more readily identified. Again, not everyone loses their sense of smell.
Perfect, thank you. We have a question about what we're doing at Hackensack Meridian Health. Do the colleagues of ours that are working in non-COVID areas have to wear plastic face shields as well as masks, or are they just wearing masks?
All right, I'm not sure if I 100% understand the question. but face shields really are indicated in patient care areas when there is anticipation of droplets to be splattered into the face, okay, and to expose the eyes. So if we are a Hackensack Meridian healthcare worker that just so happens to have a desk job, for instance, the expectation is that everyone will be masked themselves. And by all of us universally masking, we are containing the droplets universally. So each person is containing their own droplets, therefore reducing the risk against anyone else, receiving exposure to those droplets.
Great, thank you. Someone has submitted, it's really hot to wear a mask now. Is it okay to take your mask on and off if you've washed your hands and haven't touched anything else?
Do we know what environment this is in?
No, it doesn't say. So I'm just assuming that it's, in a generality.
Okay.
Are they able, is it safe to take your mask on and off as long as your hands are clean?
All right. So I'm not really sure exactly from what perspective this question is coming, but I'll give you an example. So I have an office. I sit all by myself in my office all day long. Okay. If I am in my office all day long with my door shut, I will take my mask off. Okay. But the moment that I get up from my desk and walk out of my office and open my door, that mask is on my face. Okay. So the expectation is if I am coming in contact with anyone, I am containing my droplets so that I am not exposing that individual. COVID is not an airborne infection. So if I happen to cough or sneeze or, breathe into the air, I'm not going to be breathing COVID into the air so that it will be suspended in the air. It's considered a droplet transmitted infection face to face, or again, contacting a surface and then spreading it on our faces or touching our mucous membranes. The only way that we know of at this point that it becomes airborne is particularly during suctioning of patients that are ventilated, or in certain situations like that in which we can make it airborne.
Perfect. Another question we have is one of our viewers wanted to know is when I come home from shopping, should I change my clothes and take a shower?
I don't. There's still some people in this world, no matter what their exposure is, they like to kick their shoes off by the doorway. But just because you're out shopping does not mean that you have COVID on your clothing. Again, you should be masked. People coming in contact with you should be masked. You're keeping your 6 feet distance from anyone's droplets. Certainly, if you feel as though someone's droplets have come in contact with you because they have potentially violated your 6 foot space, maybe if that makes you feel better to do so. But sorry, I don't. So if that gives you any answer.
Okay. We've had so many questions that were pre-submitted in our chat, and we only have time for a couple more. So one of the questions is, at this point, is it safe to use a inside gym?
All right. I don't believe gyms have opened yet in New Jersey, and if something has changed that I'm not aware of in the last 24 hours, please correct me. I am fearful of an environment like that at this point in time, because unless they socially distance all of their equipment, unless everyone wears a mask, unless everything is meticulously cleaned and everyone is meticulously cleaning their hands with hand sanitizer, it's going to be very hard to control. I do know that there are some private sessions that people are holding, but again, we need to constantly keep in mind our social distancing, and anything that's used in common is potentially contaminated. So at this point in time, I cannot say that it's necessarily safe until the government says it's truly safe and the measures have been taken.
Perfect. Another question that we had is how safe is it to have someone in your home, whether it be a babysitter, a nanny, a contractor, or just having some guests?
Unfortunately, I have to reverberate and remind everyone that we're not out of the woods. So we really are not at the point that we should be having guests. We shouldn't be bringing anyone into our home who's not part of our home. Certainly, if you have a broken toilet and you need a plumber to come and repair your home, or you have an electrical problem, we need to take those sort of things into consideration. And a lot of these contractors, their bosses are taking their temps before they come into a home. They are universally masking. So let's look at it from the perspective of, if someone has to come in and repair your bathroom, that individual is going to come into your house and they're going to be masked. And you're going to stay 6 feet away from them. You'll do your business from 6 feet apart. And when the time comes for that person to vacate your premises, you should wipe everything that they would have come in contact with and clean your hands. You should also encourage that individual to clean their hands. They shouldn't be coming into your house with the same gloves that they brought from the outside, because as I mentioned before, gloves do have a tendency to collect infection and carry it all over the place. Because again, we don't know where those gloves have been before. So again, I would recommend that if you have a problem in your home that needs repair, certainly address it. But if it happens that, again, I'll give you an example. My mother's 80th birthday is next week. So I am not having a gathering, unfortunately, for my mother's 80th birthday. I have to postpone it. So we want to be very careful that we're not bringing people together that don't normally live under the same roof, because we have asymptomatic carriers. And when they're in your home in an uncirculated environment within 6 feet of each other, using the same utensils to serve their buffet items, we have a very high risk for infection.
Okay, and I think we have time for one more question. In generality, what is the best mask that people should be using?
All right.
And we know it's for different situations, so I would say
Sure.
it's probably more for the common everyday
community.
person who's not in the
Definitely.
medical field.
Definitely. Thank you so much. So at the very beginning of all this COVID activity we were experiencing, all of the Home Depots and Lowe's stores were getting depleted of the N95s that were present in their stores, because those items are normally used for dealing with some hazardous products, aerosolized chemicals and so on. So they're normally in that environment. But N95s are normally used for healthcare workers that are treating patients in which COVID is being aerosolized at them. Okay. Normally for blocking COVID and preventing COVID, we certainly just need a barrier. It does not need to be a fit tested N95 or like respirator. We do not want those, some people call them Darth Vader masks. We don't want those cartridge masks to be worn around. Some of these other types of masks can present health conditions for people because they're very hard to breathe through over a period of time. So what you need is everything that I kind of referenced before. You can wear a bandana, you can wear a decorative cloth mask, you can wear a disposable mask like this. But again, once it gets wet, once it gets soiled, it needs to be disposed of or washed. So that's something we just have to continually reinforce for ourselves. But certainly a barrier is what we need to prevent those droplets from leaving us and traveling through the air and contacting someone else.
Great. Well, thank you so much, Doreen. Your knowledge is just, I don't even know if I have the right words to say, but this has been truly a great webinar. And if I could say on behalf of all the viewers and all the feedback that we're getting, that you have given such great insight, and they enjoyed the fact that your personal approach and you gave very common sense answers. to a lot of the questions that were posed out there. So on behalf of all of our viewers, I'd like to again say thank you to you. I just wanted to let everyone know that we will be sending out an evaluation of the program within the next couple of days, which will also have a link to the recording of the program. Please make sure that you send us your feedback. We'd really appreciate it. We are also offering another webinar on July 13th. This webinar will be called Boost Stress Management Today, Resilience Techniques to Adapt to the New Normal. And this will be spearheaded by Dr. David Leopold, who is our Network Director of Integrative Health and Medicine. And it will be again on July 13th at 11 a.m. So please feel free to register for that one as well. And please continue to check our website. We are continually adding more and more webinars. And again, I'd like to say thank you for everyone for attending, and I hope that you all enjoyed it. Thank you and have a great day.
Thank you, everyone.